Mamas, welcome to Prenatal Care 101, a midwife's guide. I'm here to help you feel informed, supported, and safe right from the start. So, let's dive in. First off, what exactly is prenatal care? Prenatal care is the medical care, education, and emotional support you receive throughout your pregnancy. It includes scheduled visits with a healthcare provider, like a midwife or obstetrician, who monitors your health and your baby's development. This care begins from the moment you discover you're pregnant and continues until your baby is born. So, why is prenatal care so important? Well, it helps detect potential complications early, supports a healthy pregnancy and birth outcome, ensures both you and your baby are growing and developing well, provides trusted information about nutrition, lifestyle, and emotional changes, and creates a relationship of support and trust between you and your care provider. When should prenatal care begin? Ideally, as soon as you find out you're pregnant, often around 6 to 8 weeks. Your first visit is usually the longest, as your provider will gather your health history, confirm your pregnancy, and set a care plan for the coming months. What happens during prenatal visits? Routine appointments typically include checking your weight and blood pressure, measuring your belly as pregnancy progresses, listening to the baby's heartbeat from week 10 to 12 onwards, blood and urine tests to check for infections, anemia and blood type, ultrasound scans to monitor your baby's growth and position, and counseling and guidance on pregnancy symptoms, labor prep, and more. Appointments become more frequent as pregnancy advances, monthly until 28 weeks, bi-weekly from 28 to 36 weeks, and weekly from 36 weeks until delivery. Now, what tests are common in prenatal care? Throughout your pregnancy, you may be offered various screenings like first trimester screening for genetic conditions, blood glucose tests for gestational diabetes, Rh factor testing, ultrasounds at 8 to 12 weeks for dating and 18 to 22 weeks for anatomy, and a Group B strep test around week 35 to 37. These tests are important to monitor your health and identify risks early, but you'll always have the right to ask questions or decline certain tests based on your comfort and beliefs. But remember, you play an active role too. Take your prenatal vitamins daily, especially folic acid. Eat balanced, nourishing foods to support baby's development, stay hydrated, and move your body gently with activities like walking or prenatal yoga. Get plenty of rest, your body is working hard. Track your symptoms and communicate any concerns. And avoid harmful substances like alcohol, tobacco, and certain medications. Emotional and mental support matters too. Pregnancy brings more than just physical changes. It affects your mind and emotions. Speak openly about your fears or mood swings. Ask for support if you feel anxious, overwhelmed, or sad. Join pregnancy support groups or talk to a counselor if needed, and surround yourself with encouragement and calm. Prenatal care is more than a checklist. It's your safe space for questions, growth, and guidance. It's a chance to learn about your baby, prepare for birth, and feel supported every step of the way. Whether you're a first-time mom or growing your family, know this: you deserve gentle care, good information, and a peaceful journey to motherhood. If you found this helpful,